Good morning, students. Today we are starting revision classes. Today topic is blood revision. First of all, define erythropoiesis is I'm going to discuss about essay, short notes, and how to write, how to present the paper. Okay. First question is define erythropoiesis. Discuss in detail about the factors affecting erythropoiesis. Add a note on maturation factor. Okay. First, we have to write definition of erythropoiesis. Already we know that what is erythropoiesis. Erythropoiesis is the process of the origin, development, and maturation of erythropoiesis. Erythrocytes. Okay, we have to write definition and discuss detailed about factors affecting erythropoiesis. Factors affecting erythropoiesis and stages we have to write in this topic and add a note on maturation factor. Okay, and what are the stages in fetal life? We divided into mesoblastic stage, hepatic stage, myeloid stage. Okay, we have to write at that one and process of erythropoiesis. What are the changes during erythropoiesis? Stages. What are the stages here? Number one, the various stages between colony forming unit, that is cells are matured into RBCs. It will go under process. Number one, proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte. Finally, it forms RBC, mature erythrocytes. You write these steps and you draw the diagram nearer to that. Don't draw the diagram after that. Okay. Why? Because the cell, what will happen in proerythroblast, the cell size is large and it will be reduced till up to 7.2 micrometer. Okay. We have to show that one mainly. And after that, factors affecting what are the factors necessary for erythropoiesis? General factors necessary for erythropoiesis are erythropoietin, thyroxine, hemopoietic growth factors, vitamins are very important. Okay, and we have to explain little bit, not more than that. Okay, we have to explain little bit. Now coming to maturation factors, they asked separately maturation factors. That maturation factors, what are they? Vitamin B12, intrinsic factor, folic acid are necessary for maturation of RBCs. We have to explain detail. Detail means not too much. Just you have to explain. Why they given the question like this? Define erythropoiesis. Discuss in detail about the factors affecting erythropoiesis. Add a note on maturation factor. See here, define the erythropoiesis. The marks is two marks they will give if you write definition alone and discuss in detail about the factors affecting erythropoiesis. That is, they will give 5 marks. Okay, and add a note on maturation factors. If you are adding that maturation factor, you will get full marks, 10 marks. Okay, fine. Okay, I hope you understand how to write the essay. Define erythropoiesis, discuss in detail about the factors affecting erythropoiesis, and add a short note on maturation factors. My kindly request to you, please draw the diagrams. Please draw the diagrams. If you draw the diagrams only, you will get the full marks in this question. Now, the second question is describe the clotting mechanism. Add a note on oral anticoagulants. They can ask like this also. They can ask what is hemostasis and explain the mechanism. And another type they can ask define blood clotting and explain the mechanism of clotting mechanism. These are the same question, same answer. First, what you have to write hemostasis. What is hemostasis? Arrest or stoppage of bleeding. Arrest or stoppage of bleeding. Stages. What are the stages of hemostasis? When the blood vessel is injured or injury initiates a series of reactions, what will happen? It occurs in 3 stages: vasoconstriction, platelet plug formation, and finally coagulation of blood. Okay, these are the stages we have to explain. Okay, and here mechanism, that is, what is the mechanism here? Coagulation already we know, that is, what are the mechanism here? Number one, stages of blood clotting: formation of prothrombin activator, conversion of prothrombin into thrombin, conversion of fibrinogen into fibrin. Okay, fibrinogen into fibrin. Here we have to write the stages. Number one stage, what is that? Formation of prothrombin activator. In that we have to explain little bit, that is intrinsic factor, intrinsic pathway, and extrinsic pathway. We have to explain detail, and we have to draw the flow chart. Okay, we know that one. And another one, before that, clotting mechanism, what we have to write: factors involved in blood clotting. What are the factors involved in blood clotting? Number one factor is fibrinogen. Number two is prothrombin. Number three is thromboplastin. Number four is calcium. Number five is labial factor. Number six is presence has not been approved. That is absence. Okay. So factor 7 is stable factor. So factor 8 is anti-hemophilic factor. Factor 9 is Christmas factor. Factor 10 is Sweat factor. Factor 11 is plasma thromboplastin. Factor 11 is Hegman's factor. Factor 13 is fibrin stabilizing factor. Okay, these are the factors we have to write. After that only we have to write the mechanism of, what is that? Clotting mechanism. Stages of clotting mechanism, already I told you, that is three stages. That one is formation of prothrombin activated, conversion of prothrombin into thrombin, conversion of fibrinogen into fibrin. Okay, and what we have to do here, add a short note on oral anticoagulants. Oral anticoagulants. Anticoagulants, as we know that one. What is that anticoagulants? Anticoagulants are the substances which prevent or postpone coagulation of blood, are called anticoagulants. There are three types anticoagulants used to prevent blood clotting inside the body, that is called in vivo. An anticoagulants used to prevent clotting of blood, that is collected from the body, that is in vitro. Anticoagulants used to prevent blood clotting both in vivo and vitro. Okay, for example, what are the? Heparin. Okay, heparin, coumarin derivatives, EDTA, oxalate components, citrates are the, what is that? Anticoagulants. We have to write short note only. What are the oral anticoagulants we are using here? Okay, fine. I hope you understand how to write. Now I'm going to discuss about short notes. Number one is define anemia, explain the types of anemia. See here, anemia. Anemia, we know that, what is that? Anemia, decreased oxygen carrying capacity of the blood. That is reduced RBC cells, called anemia. And explain the types. The types we know, that is classification of anemia is two types: morphological and etiological. In morphological, depending upon the size and the color of the RBC. Size of the RBC is determined by mean corpuscular volume, and color is determined by mean corpuscular hemoglobin concentration. Okay, there are four types. Sorry, there are four types. Number is thrombocytic pneumochromic anemia, macrocytic pneumochromic anemia, macrocytic hypochromic anemia, microcytic hypochromic anemia. We have to explain. This is detailed. And etiological classification. On the basis of etiological, the anemia is divided into five types. What are they? Hemorrhagic anemia, hemolytic anemia, nutrition anemia, nutrition deficiency anemia, aplastic anemia. Okay, and anemia of chronic disease. Hemorrhagic anemia, already we know. Everything we have to explain little bit, and you have to in Shamlingan they given the types of anemia nicely in the tabular column. You write that one more than enough for 3 marks question. Okay, 5 marks, sorry, 5 marks. And signs and symptoms, just you explain what are the changes in skin, What will happen? The skin color changes, pale in color. The paleness is more constant and prominent in buccal and pharyngeal, mucous membrane, conjunctiva, and lips, earlobes, palms, and nail beds. Okay. And what are the changes in cardiovascular system? There is increase in heart rate and cardiac output. Heart is dilated and cardiac murmurs are produced. Respiration, what will happen in respiration? Increase in rate and force of respiration, and digestion, anorexia, nausea, vomiting, abdominal discomfort. Okay, we will see in anemia. Metabolism, basal metabolic rate increases in severe anemia. Okay, like this we have to explain each by each. And types of anemia, sorry, next question. Types of WBCs with the normal function. What are the types of RBCs? We know that what is the WBCs? White blood cells. These are the classified into granulocyte and agranulocyte. Granulocytes are, what are the granulocyte? Eosinophil, neutrophil, and basophil. Okay, and agranulocytes are lymphocytes and monocytes. And draw the diagram according to that, according to the cell, and explain detail. Okay, explain detail. And what are the leukocytes? What are the functions? Main important. What are the properties? What is the function? We have to explain each by each. Neutrophils. What is the function? What is the function of neutrophil? Important role in defense mechanism. Along with the monocyte, it will act. Okay. And what is the eosinophil function? It acts as a anti-allergic or anti-inflammatory reaction. Okay. And what are the function of monocytes? Monocytes is nothing but they are the largest cells among the leukocytes, and they are also mainly participate in the defense mechanism along with the neutrophils. Okay. The basophil play important role in healing process, so their number increases during healing process. Important role in allergy or acute hypersensitivity reaction. This is because the presence of receptor for IgE basophilic membrane. Okay. And lymphocyte, well, we know that is they are very important in immunity. Yeah? T lymphocyte and B lymphocyte. Like that we have to explain. Now coming to blood groups. Okay. Blood groups. How we are going to write blood groups? Here we have to write the blood groups, like definition. The membrane of human red blood cells contain many antigens known as agglutinogens. The plasma antibody that react against them are called agglutinins. See here we have to write they are classified into classical ABO system, Ranger system, other systems like MNNs and P blood grouping system. We have to explain not that much, little bit any one system you explain and write the what are the importance, and you have to mention Landsteiner law. We have to mention Landsteiner law. Okay. Okay, students, understood? And erythroblastosis fetalis. It is very important. This is also hemolytic disease of newborn children. Okay, it happens when mother is Rh negative and father is Rh positive. The body inherits the Rh positive antigen from father. As a result, mother develops anti-Rh agglutinins following exposure to the body's Rh antigen. Okay. Mother's agglutinins diffuse through placenta into fetus and cause agglutination of red blood cells. These agglutinated red blood cells hemolyzes and release hemoglobin into the blood. Okay, macrophages present in the fetus convert the hemoglobin into bilirubin that causes the baby's skin to become yellow as result of development of jaundice. Okay, usually the first born child is normal. Carefully listen. First born child is normal and synthesized of Rh negative mother occurs as birth. In such in other pregnancy, what will happen? That remaining antibodies are remained in the body. It will act on the second baby. The causes, maybe the baby will be, they, what will happen, they will die. Okay. Destruction, the changes occur in the fetus called hemolytic disease, as they are due to destruction of RBCs by maternal antibodies. Okay. If the hemolysis in the fetus is severe, it can die. It can die in utero or may develop anemia or severe jaundice. Okay. Okay, okay, girls. Hope you understand how to write. Now, fifth question is plasma proteins. Plasma proteins are, we know that one. They may ask short notes, 2 marks questions also, 2 marks also they can ask, or 5 marks also they can ask. In 2 marks, you have to write what are the plasma proteins, and give shortly two functions of plasma proteins. Enough. Okay. And in 5 marks, if they ask, you have to write detail. What are the plasma proteins? Plasma proteins are albumin, globulin, fibrinogen. Okay. And prothrombin also we can tell. Okay, fine. And we have to write the functions. What are the functions of plasma proteins? These are the very important. The plasma proteins are very essential for the body. The main role is role in coagulation of blood, role in defense mechanism of body, role in transport mechanism, maintenance of osmotic pressure in blood, role in regulation of acid base balance, role in viscosity of blood. If you explain this one, more than enough for plasma proteins. ESR. ESR is nothing but erythrocyte sedimentation rate. Okay. They won't ask, they will ask for 2 marks question. Write the definition and what are the importance of ESR. More than enough. And reticuloendothelial system. Reticuloendothelial system. This is very important for function, play important role in the defense mechanism of the body. And write the we can call also tissue macrophages. And main function is phagocytic function, secretion of bactericidal agents, secretion of interleukins, secretion of tuber necrosis factor, secretion of transforming growth factor, secretion of colony stimulation factor, secretion of platelet derived growth factor. These are the important functions. If they ask 5 marks, you write detail. Otherwise, no need. Just you write 5 lines, more than enough. Okay. And what is the disadvantages of mismatching blood groups? This will ask only for 2 marks. And what are the mismatch transfusion reactions? Mismatch transfusion reaction is the most serious and potential fatal hazards of the blood transfusion. There may be agglutination, tissue ischemia, hemolysis, hemolytic jaundice, circulatory shock, hemoglobinuria, acute renal shutdown, and uremia. Okay. And finally, list the functions of platelets. Functions of platelets, you have to write the functions. Platelets have 3 important properties, that is adhesiveness, aggregation, agglutination. Okay. If they ask in 5 marks, you have to explain the structure also. You have to explain the structure also. If they ask for 2 marks, no need structure anything. Write 3 functions of platelets, more than enough. Okay, more than enough. That is, what are the functions? Role in blood clotting, role in clot retraction, prevention of blood loss, and role in repair of ruptured blood vessels, role in defense mechanism. You write this one for functions of platelets. I forgot here to add hemoglobin. Functions of hemoglobin. You write the functions of hemoglobin, more than any 2 or 5 functions of hemoglobin, more than enough. See, this is the summary of blood. We'll go through this, how to write and what to write, what not to write. If necessary, draw the diagrams. Okay. Now if 2 marks, there is no need to draw diagrams. In 5 mark and essay, if you want full marks, draw the diagrams and explain it properly. Okay. Thank you. Hope you understand. Thank you. Thank you, students. If any doubt, Feel free to ask.